this lecture, you would be able to get all of them correct. But the entire idea was we need to understand the concept and apply in the exam. And I think many of the questions were directly from the regular classes. I think this particular exam was more like concept oriented rather than recall. Like there's a X-ray where you could see clear slipping of one vertebra over another, that was spondylolisthesis. There was an image showing you IVP, and they had asked that where it can be used. So IVP is a non-invasive test, can be used for PUJ obstruction, cannot be used for bladder cancer, cannot be used for percutaneous procedures, or it is not invasive. Then there was a question which had a clear-cut image of Lier sign, but the history was saying it could, when you compress it, it empties and that fills up slowly. So history is suggestive of a pseudoaneurysm, but the image was, most, I think 99% of the students said this was the image. So whenever there is such a disparity, we go with the radiological image. This is Lier sign. Carotid body tumor will be the best answer. Then there was an image where there was a dural based mass and it had the dural tail sign. This was meningioma. Characteristic question, very often asked and directly from your class notes. And if you have attended the regular class, you would also know that if you see junctional zone hypertrophy, endometrial thickness was marked. There was junctional zone thickening with cystic changes. This was adenomyosis in a middle-aged woman with lower abdominal discomfort. That was the paper. There was a barium image in which they had marked the white colored arrow. This is the piriform sinus. Above it, you see the vallicula. So the answer was piriform sinus. Patient had stiffness of back, uveitis, X-ray was normal. Now you need to do a MRI SI joint to look for changes of ankylosing spondylitis. This is directly a classroom question. In one of the images, this was the liver visible. Below the liver on the right side in the coronal image, a cystic mass was seen, but the kidneys were not seen. So if the kidneys were not seen, that means we are more anterior. Probably most likely we are looking at a gallbladder mass based on the anatomical correlation of the image. But there was some questions and controversy regarding what was the exact image, which I will further look for. And this image, trachea is slightly towards the right. That is how anatomically trachea is. The horizontal fissure is normal. Fever with cough, expectoration. This was right upper lobe consolidation, directly straight from your classes. We have discussed this at length. Child with painless limp. I discussed this in the predictor series. If a 8-year-old child with painless limp, you see there is flattening of the femoral capital epiphysis, increased density. This is all classical of Perthes disease of the hip. The answer was Perthes disease of the hip. So once again, we had a great strike rate in this particular NEET PG exam, and the concepts win. I am sure if you had only mugged up a few images